Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health. And today's podcast topic in the spring of 2023 is joint pain, muscle pain. What is a woman to do? We're going to talk about supplements, about diet, how much this may or may not be a menopausal symptom. And then we're going to wrap up and talk about joint replacements and what to do if you or a loved one needs to have a major joint replacement. And actually, because women have a lot more arthritis than men, women are more likely to have both hip replacement and knee replacement. So what should you do if diet and exercise and judicial use of supplements don't help your joint pain or muscle pain? How should you deal with painful muscle spasms? Well, you want to seek a physician's help for an evaluation, which might include x-rays, blood work, and chemistries and vitamin levels. You also may need to work closely with a physical therapist, and many times an occupational therapist can be beneficial, as well as perhaps a chiropractor. What causes muscle spasms? Well, they're very common, especially if you're dehydrated or have any electrolyte imbalance. A special category in women is pregnancy muscle spasms, because pregnancy is associated with muscle spasms because the growing baby and placenta will exact nutrients needed to grow. And if calcium, magnesium, potassium levels are low, then they're going to be taken from the big muscles of the mother's body if the bloodstream levels are insufficient. Now, you can certainly take magnesium, particularly if there's no kidney insufficiency, and that can be very helpful for pregnancy-associated leg cramps. Now, this, of course, is not medical advice. This is a podcast designed to empower you to be strong, be healthy, and be in charge, and really come prepared with questions when you see your health care clinician. It's always a great idea to stretch out the muscles, and that might stop like that Charlie horse. And many people keep footboards at the bottom of their bed, as leg cramps can occur at night, and many times placing your foot and extending it will stop the cramp. And this kind of sounds like an old wives' tale, but a lot of my patients have told me they really do think it helps. Some people will place a bar of ivory soap under the bed sheets to keep the bed sheets from pressing on the feet and possibly triggering a spasm. But actually, recent research has suggested that the muscle spasms are triggered by nerve changes. And actually, ingesting something spicy like jalapenos or cinnamon might interrupt the aberrant nerve impulses that are stimulating the muscles to contract and spasm. Now, choline is a supplement. It's also in many foodstuffs, and that might help reduce muscle cramps. So some of the choline-rich foods you want to start with can include veggie, eggs, including the egg yolk, dairy, fish, beans, and nuts. Exercising induced muscle spasms. Certainly you've seen those athletes on the field who in the middle of their athletic performance have severe muscle cramps, and they're certainly encouraged to hydrate and ingest mineral-rich liquids or even spicy substances such as mustard or pickle juice to stop the spasms. Topical magnesium can be applied to the muscles before bedtime, and that might be helpful, just like soaking in Epsom salts, which is magnesium. Quinine or quinine water has been used to treat muscle spasms for a long time, but it can occasionally cause low platelet count in people, so I really don't think you should do this unless you're under a physician's supervision. Certainly, if you suffer from muscle cramps, be sure to see your physician for an evaluation before you self-treat. Now, I can tell you that since I'm an osteoporosis expert and I treat lots of women for osteoporosis, many of those agents which help drive bone building activities, if there's not sufficient substrate, then many times the body will just steal it out of the muscles and cause muscle spasm. And so a lot of people think it's a side effect of the osteoporosis medicine when all it is just an effect of the lack of them having the basic building blocks that their body and bones are requiring. We sometimes see this in pregnancy, as mentioned, as well as in women starting birth control pills if they're hormonal contraceptives, which have estrogen, which drives calcium into the bones. And if there's not enough calcium in the bloodstream, it's going to steal it out of the big muscles. And that is painful. So what are some treatments for muscle pain and muscle spasm and joint pain? Well, some of the go-to agents, which are many of them are over-the-counter, are non-steroidal anti-inflammatory drugs, so-called NSAIDs. And that includes aspirin, ibuprofen, naproxen. And they have been available over-the-counter for quite a while, as well as available in higher dose prescription levels. They're potent, they're anti-inflammatory, and in a lot of people, they can reduce joint, tendon, and muscle pain. However, I caution against their routine use because they can increase GI bleeding, stomach ulcers, and in some cases, increase a person's risk for heart attack, stroke, and kidney damage. Now, they're very potent at reducing pain, and they certainly are a potent option, but they should not be your first line of treatment. There are so many they're very effective when people take them, and then they just forget about focusing on other things that they need to focus on, like diet and exercise and other potential anti-inflammatory substances that might help their symptoms and afford less risk than a pharmacologic agent. So even though these agents you can buy over the counter, if you're taking them regularly, you need to fess up to your physician and get regular blood work, blood pressure checks, and blood work, including kidney function and complete blood count. And if you need to use a prescription dose of NSAIDs, like aspirin, ibuprofen, or naproxen, you might want to try these in a topical formulation that you can rub directly on the joint. Low-strength salicylic acid is available in sprays and gels and patches, and they're generally over-the-counter and can give you localized pain reduction. Now, sometimes when I've sprayed them on my sore knee, my husband jokes because of the menthol that I smell like Walter. So you can absorb quite a bit through the skin. So wrapping your entire body in the patches is not a good idea. Acupuncture. Well, acupuncture is part of traditional Chinese medicine, and it's generally considered safe. Adverse reactions are usually rare and can include local site tenderness. And acupuncture has been studied and has shown improvement in chronic low back pain, certain forms of tendinitis. I had it for tennis elbow, fibromyalgia, severe migraine headaches, and it's also used for low back pain in pregnancy. As far as osteoarthritis of the knee, there's mixed results with acupuncture. Some showing no change, and other studies showing benefit with acupuncture. So how do you care for aging muscles? Muscles, just like joints and tendon, age, and they do need extra care with aging. We're all pretty much familiar with changes in eyesight with age, changes in skin with age, decrease in kidney function with age, but a lot of people don't expect that their muscles and tendons are going to age. Certainly most people are familiar with joint aging, but it's really all interrelated. You should stretch before and after exercise, and it's very important the older you get to have a warm-up period. It's also important to know that some common medications like cholesterol-lowering statins can cause muscle pain and damage, particularly when mixed with certain antibiotics and medications. Some antibiotics like ciprofloxacin, brand name Cipro, and other fluoroquinolones used for serious infections may increase the risk of tendon rupture and now carry a boxed warning. Restless legs. Well, that is another common condition, but it's different than muscle spasms. People describe an irresistible urge to move the legs, especially at night. And some causes of this include low iron and low magnesium. So if you have restless legs, you should definitely see a healthcare clinician and get your iron, ferritin, and red blood cell count magnesium levels checked. Because your goal level of iron ferritin is at least 50 to 70. You might want to consider magnesium supplements at night for sleep and leg cramps, especially if normal kidney function and no GI distress. Fibromyalgia. We have a lot of information on our website about fibromyalgia, a very common condition. And not all body pain comes from your joints. So fibromyalgia is a particularly common chronic pain condition, which is actually seen more commonly in women, especially as they get older. And it's a real condition that causes widespread muscular pain over certain parts of the body. What is clear is that fibromyalgia pain does usually improve with improved sleep hygiene, treatment of any underlying sleep disorders, which become more common with age and menopause, like obstructive sleep apnea. Regular exercise regimens that include stretching and a warm-up, along with aerobic exercise and weight-bearing exercise, should be part of a healthy regimen. It's also very important if you have muscle pain to correct any low vitamin D, which is pretty widespread in adults over 40, particularly at northern climates. There are FDA-approved medications for fibromyalgia, such as the norepinephrine serotonin reuptake inhibitor like Cymbalta, generic name duloxetine, Savella, brand name Milnacipran, and then nerve medications or anticonvulsants like Lyrica, generic name pregabalin. If you have joint, muscle, or tendon pain or diffuse body pain, it's important to get evaluated, focus on diet and exercise, get good sleep, and use judicious use of supplements. And if you require either over-the-counter chronic medication and or any prescription medicine, you want to get regular monitoring. Now, certainly, when I was a resident and on call and up for 36 plus hours at a time, I really could identify with my patients with fibromyalgia because I had the exact point tenderness from lack of sleep. So, it is a real condition, although it's one that's clinically diagnosed and we're learning more and more about. So, next I want to talk about 8 supplements that can help joint pain, because joint pain is pretty ubiquitous with the human condition, particularly after age 30. So you may ask, what can I do for my joint pain? It's such a common question that I hear almost every single day from my patients. Osteoarthritis is also known as degenerative joint disease, and it increases with age, and up to 80% of people have some form of osteoarthritis. The joints that are most commonly affected include the ones that take the biggest, most weight-bearing and abuse, such as the big toe. A lot of people, even in their 20s, start to get a bunion, and that's simply osteoarthritis of that MCP joint. Knees, hips, and then the spine. This is also colloquially known as wear and tear arthritis. Certainly, men and women who've sustained sports injuries are at greater risk of degeneration of the joint. Common everyday activities do produce wear and tear on the joints, particularly if your body weight is increased. Even a 5-pound weight gain transmits 5 times, which would equal 25 extra pounds of pressure to the lower body joints. So, maintaining normal body weight is important. Also, avoiding carrying heavy items like your grandchild, like overstuffed grocery bags, like a huge purse is also important. And even though the podcast I did on midlife weight gain was directed towards physicians and healthcare clinicians. Certainly, more information on the expanding field of obesity medicine and the non-prescription as well as prescription options and therapies for weight gain. That's an excellent CME podcast that I did with Dr. Tara Iyer. Stretching and strengthening exercises are important because they stabilize your joints. And since the tendons, joints, and cartilage do not have any direct blood vessels, movement in the form of activity, specifically aerobic exercise that gets your heart rate up, is so important for diffusing both oxygen and nutrients into the joints. So the old saying goes, you get stiff and then you get old. It's not that you're old and then stiff. You must prevent joint stiffness, and a large part of that is movement. So the supplements and medications to help joint pain, number one is vitamin D. And it's not a vitamin. It's a prosteryl hormone. And I dedicated an entire podcast, I think it was my second one, to vitamin D. And humans can make vitamin D if they're exposed to the right ultraviolet light. But most of my patients over age 40 and certainly over age 50 are low in vitamin D. And a simple blood test of a 25-hydroxy vitamin D test will show this result. Now, the 125-hydroxy test is sometimes erroneously ordered by folks, and that's usually always normal unless there's kidney failure. So you just want the plain 25-hydroxy vitamin D. And certainly the older you get, skin does not make vitamin D as efficiently as it does in young people. If you have joint pain, you might want to consider starting 1,000 to 2,000 units of vitamin D3 cholecalciferol daily.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
At least have your healthcare clinician check your level. Supplement or medication number 2 for the joints, estrogen. Estrogen is important for musculoskeletal health, including joint health. There are estrogen receptors in both the cartilage and tendons as well as bone. You can certainly catch our podcast on osteoporosis and the importance of estrogen. Many postmenopausal women with low estrogen might just complain of joint pain and joint stiffness as their primary menopausal symptom. In fact, in Asian women, this is very common. And I probably get at least one referral a week from a rheumatologist who has evaluated a woman for joint pain that's relatively new onset with no rheumatologic disease found. And they will refer them to me for menopausal hormone therapy, which in many cases resolve their joint pain. Low estrogen states in some women can exacerbate tendinitis. Postpartum is a time that the hormone levels dramatically drop, and I remember having both of my hands in splints after I had my first son, and my estrogen levels dropped. I had bilateral de Quervain's tenosynovitis, and that was painful. I have some hand surgeons who refer me patients for tendon and joint swelling in the hands that they can see on MRI scans that occur in the postmenopausal phase, and this improves with hormone treatment. Generally speaking, estrogen therapy is not solely given just for joint pain unless there's other menopausal symptoms or this is new onset and associated with a low estrogen state. There is also some good evidence that women who undergo a total joint replacement who are on postmenopausal estrogen do better than those not on hormone therapy in terms of the longevity of their artificial joint. So talk to your physician to see if hormone therapy is right for you. Supplement number 3, glucosamine and chondroitin sulfate. Glucosamine and chondroitin sulfate are one of the most common combination supplements that I recommend to women with joint pain, particularly knee osteoarthritis. Glucosamine has shown to be protective benefit for knee arthritis in up to 70% of persons in divided doses of 1,000 to 1,500 milligrams per day. The first time I had recommended this supplement, it was several years ago. I had a woman in my office exclaim, "That's what my veterinarian has given my dog." Well, dogs, like other mammals, also suffer from degenerative joint disease with aging. Some studies have shown no benefit with glucosamine, while others have shown reductions in joint pain, particularly the glucosamine sulfate salt. Various studies have shown benefit of both glucosamine and chondroitin sulfate together, showing less joint pain and joint space narrowing in doses of 800 to 1,200 milligrams per day. So, glucosamine is frequently added to this chondroitin sulfate, and the tablets usually range in a 500 milligram glucosamine with 400 milligram chondroitin sulfate, started 3 times a day, and needs to be taken at least for 2 months to know if it's going to take effect. If the adult has a reduction in joint pain, then usually a maintenance dose of at least 1 tablet a day is recommended. If there's no benefit, after 2 to 3 months, I would recommend you stop taking it. Now, what are some of the glucosamine and chondroitin sulfate warnings? Well, it's important to know that this supplement is usually derived from shellfish. So persons with a shellfish allergy should not take glucosamine and chondroitin sulfate. And for those with shellfish allergies and our vegan friends, there are some vegan-sourced glucosamine derived from corn. There is a small amount of sugar in glucosamine, and this can elevate blood sugar. So patients with diabetes should be aware of this. And for those of you who are intermittently fasting, which is anti-aging, you want to take this supplement during the time that you're ingesting calories. Supplement number 4, MSM, methylsulfonylmethane, in doses up to 6 grams per day, has also been shown to reduce pain and improve function and in some reduce stiffness. But we don't really have long-term studies. Number 5, turmeric. Turmeric is a spice containing curcumin, and taking 500 milligrams orally up to twice a day has been shown in some to have anti-inflammatory, antioxidant, anti-cancer, and maybe even anti-atherosclerotic effects. Now, a side effect of turmeric can be increased bleeding. So if you're on blood thinners or Coumadin or Eliquis, you need to be aware of this and discuss this with your physician. And some people also have GI distress. Many times the turmeric is combined with black pepper for better absorption. Number 6, omega-3. Omega-3 fatty acids in doses of 2 to 4 grams have been shown to reduce pain from rheumatoid arthritis inflammation, chronic spinal pain due to autoimmune disease, depression, fibromyalgia, neuropathic pain, and even menstrual cramps. In general, I recommend that people ingest omega-3s via their diet as opposed to taking a supplement. And I have seen breast tenderness and breast cysts develop in women taking high-dose oral omega-3 supplements. The benefit of ingesting omega-3 in the diet in terms of reducing joint pain is likely related to the anti-inflammatory effects of a heart-healthy Mediterranean-type diet. Mediterranean diet foods include fruit and vegetables and olive oil, legumes, and fish. The omega-3 foods are fish and nuts like walnuts and almonds, seeds such as chia seed and flaxseed. I've talked about those foods in my superfood podcast. Eggs as well, especially if they're eggs from chickens fed omega-3. So keep a food diary. It's helpful to keep a log of what you eat because some people find out what foods are more associated with joint pain, such as in gluten and the gluten intolerant, even if you don't have overt celiac. Red meat in some people, trans fats, and certainly highly processed foods can provoke inflammation. So there's a lot of different reasons to follow an anti-inflammatory diet, even if you don't have joint pain. But if you have joint pain, it's crucial that you follow an anti-inflammatory diet. Number 7, ginger. Ginger is an herb that has anti-inflammatory, anti-cancer, anti-atherosclerotic, and also anti-nausea effects. And it can be ingested 3 grams per day. Number 8, SAMe, capital S, capital A, capital M, little e. SAMe stands for S-adenylyl L-methionine, and it's a compound found naturally in the body. There has been an actual supplement form of SAMe, and it's been used to help the liver. It's also been used to reduce joint pain and even elevate the mood. Doses start at 400 up to 1,200 milligrams per day, and the supplement can be pricey. Any person who's had mania, bipolar illness, or schizophrenia in general should avoid this supplement. So with aging, most of us do experience wear and tear on joints, tendons, cartilage, and muscles. But a healthy anti-inflammatory diet and appropriate vitamins and supplements, pain and stiffness can be reduced. There's other enzymes that may be helpful, like bromelain, which is in pineapples, and other substances like boswellia that may be helpful. But because these supplements can interact with other medications, it's really important to let your physician know all the things that you are taking. And it's also important to wear proper footwear and to make sure that your muscles are equally strengthened. So, can you just eat yourself out of joint pain? Well, food as medicine is certainly a hot topic, and we know that there's lots of benefits on heart disease, diabetes. There's also medicinal effects of herbs and spices. I'll have to do a future podcast on that, being the spice of life. We talked about the benefits of the Mediterranean diet. And certainly vitamin C, which is in foods like strawberries and pineapples and broccoli and bell peppers and Brussels sprouts, are very important. And so are carotenoids, such as think of the yellow and orange foods like squash and sweet potato, mango, even carrot cake. We've got some great recipes on our website, and the late, great Holly Clegg has published many cookbooks, including one on recipes to ease arthritis pain. I would highly, highly recommend that. And even desserts could be healthy too. One of my favorite dessert recipes is a dark chocolate paired with berries, which is packed with antioxidants. And several of Holly Clegg's dessert recipes include pineapple and shredded coconut, which are good for the joints. As I mentioned earlier, pineapple contains bromelain, which might be helpful for joint pain.
We'll be back after a quick break.
Have you ever experienced fitness failure? You set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
And there's no doubt that what you ingest affects how you feel. Science is elucidating some of the mechanisms of healthy food also on the gut microbiome, metabolism, inflammation, and also the formation of brown fat, which is metabolically active fat. Now, even with the best diet, the best exercise, the appropriate vitamins and supplements, sometimes our joints do wear out. And this next section is on preparing for hip and knee replacement. And one of our orthopedic nurses at the Cleveland Clinic, Cheryl Taylor, posted an excellent column last year on women and joint replacements. Because as we age, we still want to maintain an active lifestyle, but many will face a joint replacement for themselves or perhaps their loved one. One of my patients came in with a beautiful necklace and it had 3 diamonds. And I thought maybe it stood for her children or her grandchildren. And she said, no, each one was from her helping her husband through a joint replacement. But women themselves account for at least 60% of all hip and joint replacements done in the United States. And that's because arthritis is the major cause for the need for joint replacements, and we women simply have more arthritis than men. We also have more autoimmune conditions, which can exacerbate the wear and tear osteoarthritis. In addition, pregnancy and delivery can really affect the entire pelvic floor, which includes the hips. And any joint instability, injury, and or muscle weakness of the hip girdle can affect the integrity of the joint. And anything that happens to your lower extremity, whether it's a foot injury, ankle injury, knee injury, also can affect the hip and vice versa. Knee replacement increases in both men and women with age, as well as prior injury, wear and tear, as well as in weight gain. Up to 5% of all women by age 80 will experience a hip replacement, and 10% of women by age 80 will experience a knee replacement. And there's a small percentage of people who might have more than one joint replacement. I've got a few patients I've seen who've had 4 joint replacements. How do you know if you need a hip replacement? Well, some of the symptoms might suggest that you need to see an orthopedist for a hip replacement include pain in the anterior groin area when walking or just laying at rest, reduced range of motion of the hip, or the feeling of instability like you might fall down when walking or pivoting, limping, which can be from pain and or muscle weakness. So how can you reduce stress on the joints? Even if you don't have joint pain, you should be thinking about this. For every 5 pounds of extra body weight, that transmits 25 pounds. And in general, 13 pounds of weight loss is generally recommended unless you're already in the normal to thin range. Maintaining good nutrition and balanced muscle strength and good bone health is important, as well as wearing good footwear. And we've got some great columns on foot pain on speakingofwomenshealth.com. The Devil Wears Prada. So going on to joint replacement. Postmenopausal women on menopausal hormone therapy have better longevity of their joint replacement, as well as a reduced risk for osteoporotic fractures, which is bone breakage. And May is Osteoporosis Awareness Month, and you should definitely talk to your physician about your risk for osteoarthritis as well as osteoporosis. Usually they're on the opposite ends of the spectrum, meaning people with dense bones tend to have more osteoarthritis, and people who have osteoarthritis tend to have less osteoporosis. But I do have some women in my practice that have both. Now, one's age and anticipated lifespan previously factored heavily into the decision on when to undergo a joint replacement. But however, recent improvements in technology and technique has brought joint replacement as an option for younger people. Increasingly, I've seen women in my practice in their late 30s, 40s having joint replacements, not just their 60s, 70s, and 80s. Some women who've had a hip replacement at a young age have gone on to have successful pregnancies and deliveries. So what should you do before your surgery? Well, number 1, Selecting your orthopedic surgeon and their team is so important to optimizing your health, knowing what their outcomes are. Number 2, get any screenings. See your primary care physician. Also see your dentist. Get all dental work and dental cleaning completed. It's very important to see your primary care physician and get updated on all your health needs. Optimize your blood sugar and blood pressure. Optimize your weight, because that can be hard to do when you have a painful joint. Get a good working relationship with a trusted physical therapist and or trainer, optimizing your strength and flexibility before surgery. Water therapy can take the pressure off of joints and might be something to pursue post-operatively as well. Be honest with your medical team regarding all alcohol use, all medication, drug use, caffeine consumption, herbal use. You may or may not get a permission to have a sip of coffee, black coffee, for caffeine in the morning if you think you'll get a caffeine withdrawal headache. But in general, you're usually advised to have nothing by mouth after midnight on the day of your surgery, with the exception of some possible needed medications with just a sip of water. What do you want to discuss with your surgical team? Well, when discussing the risk and benefits and alternatives of total joint replacement, your surgical team will discuss the different approaches, the anticipated recovery time, and the risk, which include but are not limited to infection, blood clot, and even prosthesis malfunction. You will likely receive educational material on hip replacement, knee replacement, shoulder replacement, and you might even need to take a class. You might get your iron ferritin level checked because a lot of women run low in iron from years of menstruation, childbearing, breastfeeding, all of which lower iron levels. You might want to optimize your iron level preoperatively, and vitamin C helps you absorb iron. And my very first podcast was on iron. Sidebar: iron's also good for energy level and healthy hair. If your iron level's low and it's not explained, or if you're just over age 40, you might need a GI tract evaluation for colorectal cancer, occult loss from the stomach, or even celiac disease. If you need to lose weight or if your blood sugar is elevated, you might actually be advised to go on a low-carb keto supervised diet. What you need for your recovery? Well, prior to surgery, you might want to get your home ready. Small children and pets cause fall hazards, and you don't want to trip or fall post-operatively. You want to be a joint replacement warrior. So your surgical team will instruct you on what assisted devices that you'll need to purchase, and it might include a walker, and that your family member or friend is to bring to the hospital the day upon discharge. So you don't need to bring it preoperatively, but you certainly need to have it for the day you go home. A cane will be needed, pinchers to pick things up, an elevated bath seat, and also a toilet seat elevation, shoe horns to help you get your shoes on, and you may want to make sure you have well-fitting, good shoes that you can just slip on comfortably. Make sure your home is prepared in advance, like grocery shopping, making sure to have someone help with shopping post-surgery, freezing foods that can be easily defrosted and warmed up. It's a good idea to prepare several meals in advance and have plans for someone to help you with meals post-surgery. And if you're not having the surgery, but one of your loved ones is, this is still all important information. Finding laundry and yard work helper when you're recovering. Also, safety proofing your home. Before surgery, you should practice getting up from a high back chair with armrest and your bed with the appropriate use of a walker, reducing the weight bearing on the affected surgical limb. Using padded and seat cushions to help prevent your hip from flexing past that 90-degree arc in chairs. And also using a padded seat cushion in the passenger side of the car when you're driven home. Having chairs with cushions and armrests to help your upper body do the work when you are reducing the weight bearing on the lower body. Also, you may need elbow pads or padded workout gloves to protect your hand tendons, particularly if you have sensitive hands and tendons. You certainly will not be able to drive until you're off all pain medications and get medical clearance from your orthopedic surgeon. And this may take longer if you're having right-sided surgery as opposed to left-sided surgery. It's best to plan to take the time necessary to help for your recovery and not compare your experience to your friends or what you might read on the internet. And no, you won't be on the golf course in just a few weeks, and you shouldn't be caring for your active grandchild in the several weeks that you're recovering post-operatively. You'll need another person there if there's young children, young pets. So some physical maneuvers, icing and physical maneuvers. There's a number of different types of ice gel packs and contraptions that might allow you to ice your hip or knee to reduce swelling. And you might need to use this intermittently, 20 minutes on, 20 minutes off for several weeks. Wearing TED hose or Sigvaris support hose will help reduce swelling and blood clot risk. And it's important to never just lay around in bed without moving your legs and to not stand or sit for too long. Keep a journal nearby. Jot down your activities, medicines. The time taken is very helpful. And if you're not really up to it right away, maybe have a family member be your scribe. You won't be able to shower until you're given the go-ahead based on wound healing from your surgeon. That extra stick saran wrap can be placed over your wound to avoid water on your incision at the time of your first shower. At your post-op visit, once the wound is fully healed, you can ask your team regarding silicone scar therapies if you're interested. And sometimes the physical therapist will instruct the wound and take a picture with an encrypted phone to send to your physician to look at the wound. Wearing a compression stocking all the way up to the waist if you have a lateral hip incision might also help with the scar contouring. It's important not to get a pedicure or a shave before your surgical procedure and for at least a month after the surgery. What about packing your hospital bag? Well, it's very similar to packing your bag for a delivery, only you're not going to be going home with a new baby, but a new joint instead, which still will require your attention. Pack lightly. Do not bring any valuables, but you do need your ID, phone charger, and loose, comfortable clothes to change into. Bowel function. Opiate pain medicines significantly slow the bowels down, so you need adequate hydration, a stool softener, and you might even need some milk of magnesia or Miralax. The sooner you wean off opiates and use non-opiate pain medicine, the better your elimination pattern is. Also, ingesting high-fiber healthy foods and adequate water will aid in your recovery. One of my earlier podcasts was on fiber and constipation, and anyone who's going to be in the hospital or have any surgical procedure should bone up on that. Speaking of which, bone broths and soups are nutritious, tasty, and hearty, and many of them can be frozen in advance. So what to expect post-surgery? Well, physical therapy generally might stop in the post-operative recovery area, and certainly in the hospital. And it's very important to follow all precautions, and you'll be instructed probably verbally and also written down. Hopefully you'll be up and walking on the actual day of surgery, and you might even be discharged that day of surgery or the next. However, your pain level, ambulation, bowel function, your general medical condition, how much blood you've lost are all taken into effect. Make a list of questions for your medical team and physical therapist and occupational therapist regarding what activities you can and cannot do and what precautions that you have to follow, such as like no bending past 90-degree arc at the waist if you've had a hip replacement, no external rotation of the hip. And for the knee, active physical therapy must begin to prevent knee contractions, but it must be done under supervision. Now, sexual activity might be resumed once you're feeling up to it, but for women with hip replacement, it may take longer. So don't be too hard on yourself. And I tell patients it's kind of similar to the postpartum situation. It may be several weeks or more. Now, if you have a knee replacement, you have to follow all instructions from the physical therapist. And you need adequate pain medication so that you can work through the flexion and extension exercises. If you have a hip replacement, it may be a little easier for the recovery, particularly if it's the anterior type where they don't cut the muscles like they do laterally, but you must follow all precautions to reduce the risk of hip dislocation, particularly in the first 3 months. Recovery. You need to realize that it can take a full year or two for full recovery. And the first 2 years of joint replacement has increased blood flow to the whole entire joint area for healing and repair. Antibiotics are needed before dental work, even routine cleaning, and certain procedures for the rest of your life because there's an increased risk of joint infections, particularly in those first 2 years. You can do low-impact exercises like biking and brisk walking and Pilates, but high-impact activities like running are generally to be avoided because this can shorten the lifespan of your joint. You may have a new gait pattern and you need time and physical therapy to rehab it. You might notice some back pain or heel pain as you recover, so please wear good, well-fitting shoes. You also, especially with hip replacement, might perceive a leg length discrepancy after surgery, but this usually settles with physical therapy and time, but occasionally a heel lift might be needed. Progress and improvement is not always directly linear. Don't be hard on yourself. Listen to your body and make a commitment to focusing on your recovery. So, the author of the Hip and Joint Replacement column, Cheryl Taylor, is a nurse clinician, and she's worked with Dr. Victor Krebs for over 22 years. And she's very much involved in onboarding all the new staff to the adult total joint arthroplasty department. And she's a project leader for orthopedics for care coordination. So we certainly thank Cheryl for all of that healthy information. And hopefully most of you can avoid having a major joint replacement by taking good care of your joints and paying attention to joint pain and not ignoring it. So our message is to be strong, be healthy, and be in charge. Thank you so much for joining me back in the Sunflower House. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health. And thanks to our executive producer, Lee Kleckar. Please subscribe to this podcast and give us a 5-star rating. It helps us move up in the ratings. And we'll see you back next time in the Sunflower House.